SPSC is happy to be in Frankfurt, Germany, to meet with the founder of myoact, Simon, and to do our second episode of podcast for EMG application.
Yes, thank you for having me in your podcast, and welcome to Germany. Unfortunately, you are leaving today, I guess?
Yes.
So you had a pretty nice week in Munich and in Frankfurt.
Yes, that's right, and I will be back very soon.
Yeah.
Okay, now let's start with our very first question. So what are the key differences between various EMG assessments in sports, performance, and clinical diagnostics?
Yeah, so I guess the most important thing is when we talk about performance, we're normally not talking about injuries a person currently have, and therefore also maybe there's no pain presented. In this case, the individual is potentially able to activate on a really high level, and you can focus on little imbalances, left to right or whatever, as soon as there's a clinical perspective behind. So you have an injury or pain syndrome, the muscle activity can be affected by this, and this has to be always considered in mind. That's the reason why we implemented a different approach of using EMG, because it's based on our experiences in the practice based on patients, real patients. Therefore, for example, we use a different approach than creating, for example, a MVC and doing a normalization of the data, because this normalization can be affected by a pain situation or an injury of the patient.
I see, thank you. Is EMG testing painful, and is it considered an invasive procedure?
No, it's definitely not painful. The way we using EMG is so-called surface EMG. So you have little electrodes you can just put on your skin, like a ECG, so you don't feel anything, and you just see the muscle activity live presented on the screen.
What external factors can affect EMG signal quality, such as sweat or electrode placement?
Yes, so the electrode placement is the most important. So you always have to be sure that the sensor is placed on the muscle belly. Therefore, we have implemented in our application a guideline based on the so-called Simon protocol, where to place the sensors exactly. It doesn't have a big effect if you just not perfectly place it around a centimeter, but if you go further distance away, then it might be an issue. Sweat is also a parameter. That's the reason why we focus not on high dynamic sweating exercises, but we are focused on controlled movements and baseline activation patterns, like squeeze your whatever muscle you experience it today. So it can be sweaty, but not as much as it's not possible.
Not like when you're running.
Yeah.
Okay, I see. Okay. Can surface EMG be used to detect abnormalities in nerve conduction?
Well, it gives us an idea of the nervous system, but it's not able to say, if you have a lower EMG, you can't say it's definitely a nerve issue, like in the structure, all right? It's just a hypothesis. If you want to get an idea about the really structure of the nerve, you have to go further and make, for example, specific nerve examinations and maybe an MRI, so making a structural picture. But what we are checking is the connection of the nerve into the muscle, and if there are any issues based, for example, after a disc issue in the spine, when you have like a slipping disc and it's putting the nerve, then your activity of the target muscle is affected in every position. And if the nerve is not the problem, then you probably can't activate your muscle in specific testings, but in others you are able to do so.
Okay.
Right? And this gives us a really good hint. Therefore, a lot of physicians in Germany who are working in spine surgery, they are using our tool to quick examine, is there potential a nerve issue? And if our system is saying in every testing this muscle is not activatable, then you have a really high risk of a nerve issue, and then they bring them to, for example, the neurologist, where they do further examinations.
So EMG is a quick first test to do.
It's a monitoring, a quick check. That's the reason why it's also really easy and quick to use. But it's giving you just an idea of where to go, giving you a direction.
Okay, I see. Thank you. At which stages of an athlete's training is EMG monitoring most beneficial?
Well, the easiest way is to use after a injury or after a surgery. So when you have this return to procedure. Because in this case, you basically have one like not affected side and one affected side, and you can really good compare those two data with each other. And then you have, for example, your left leg, which is not operated in the knee. This is the guideline where you have to go. And then you have the data from your right leg, and then you start pretty much low, what is normal after surgery. But then you can monitor over the time, are you coming close to your left side? So this is the most easiest way. But we suggest to use it also in a non-injured situation, as for example, a lot of professional football clubs are using it in the pre-season checkup. So they gain healthy activation data, and if the person is getting problems over the period, they can do remapping and compare them with the data in the pre-season.
Okay, so a little bit preventative screening.
Yes.
Okay. How can EMG data assist coaches or physical therapists in adjusting training programs?
Yeah, I guess you also experienced it today. So the most important thing is sometimes we think that exercises are targeting a specific muscles, but they are not in an individual situation.
Yes.
So what we observe is that a lot of people are getting exercises by their coaches or via internet or social media, but a specific amount of exercises not targeting the muscles they are willing to train.
Yeah.
Sometimes they target the compensating muscles. And in this case, you are training against your specific aim, and you're potentially making something worse. And EMG is used to check is a specific exercises I'm giving my patient or my athlete really targeting the muscle I'm willing to have.
Okay. I see. Let me just quickly check, make sure if everything's okay, so we don't check at the end and find out something is not working. Perfect. Okay, good. And Lala can cut this part out. Okay. Okay. Is EMG suitable for use in team sports settings? And what are technical challenges when measuring multiple athletes simultaneously?
Not yet. I really must say not yet. EMG right now is a typical one-by-one use.
Okay.
So why is it like that? Because it's often necessary that the athlete needs to be explained in the first step. What is happening here? Because he needs to understand what is activity. Activity is not strength. So a lot of even professional athletes, they don't have any clue about the benefits behind a good neuromuscular activation. This has to be explained. So there's always a one-to-one session in order to explain the person what to do. As soon as he is able to understand, then you must be sure that the sensors are placed in the right position. This for sure can be done by the trainer, and then he could train on himself via biofeedback. And if everyone in the team is educated and the sensors are placed in the right direction, then theoretically they can train like in the whole team. But we see that in the normal daily routines, it's not like that, because you have mostly one trainer for 30 people, and he has to have his eyes like everywhere, even without EMG. And if you have a technology like EMG on top, you also have to check, are the sensors still okay, whatever. So we recommend to have it in a one-on-one session, and to always implement it from time to time. It's not necessary always to train with EMG, right? Just as soon as you can improve that you are able to target a muscle without EMG, then you can go alone. But something what you also experienced today, or what you have seen, is that sometimes people think they are doing something and what totally different is happening.
Yeah.
And if you see like this, then you understand that without EMG, biofeedback, it's like a blind flight. You're not knowing what is happening. But this is actually state of the art. Actually, right now, we get up in the morning, just a metaphor, and we are going blinded through the day and hoping, based on our experiences, that nothing is happening worse or whatever, and we're just thinking or doing what we think what is happening. And we are not monitoring or visualize our exercises, and that's a big issue.
Okay, and is it meaningful to use EMG in sport-specific movements? So, for example, in baseball, when you bat, or in football, when you kick, that specific movement, is it useful?
Yeah, but you have to, the more dynamic you go, the more quicker the movement is, the more multi-directional the movement is, the more signals you get. And if you just do it with a system like ours, you gain a lot of data, and you can't take the data, this was the microvolt in that position, in that angle, in that movement.
Okay, so you were talking about that earlier, about synchronization.
Yes, if you want to use EMG in a high dynamic movement protocol, you definitely have to upgrade the system with cameras, with motion detection. And then we go up to a labor setting. As you could understand, it's definitely more expensive. So there are different levels of EMG, and we are focusing on the baseline. Is your neuromuscular systems actually possible to just activate?
Okay.
And then if you improve yourself in that, then you go deeper and deeper in the sport-specific movements. But we don't recommend to start in the sport-specific movements and then step down. Because this is what I've done 8 years. I worked in these labors. I developed these labors. So we did inertial measure units. We had like the high-speed cameras. We had pressure plates, force plates,
everything.
Everything, and everything connected and synchronized with EMG. So this is what I've done for years. And I got it for some specific cases, but the majority wasn't actually able just to activate in a standing position a specific muscle. So we started always like on the top, and then we cut down and saw, okay, when he's not able, for example, a runner, in a like milliseconds before loading response, he's not pre-activating the gluteus medius. Whoa, okay, so it costs a lot of money to detect this information, but then we took this person, let him stand and say, can you please activate your right glute, and he wasn't able. So we saw correlations between that, and then we said, like, why should we start with the high end, let's focus on the low, and then go up. And that's our approach, based on actually the experience we've done or we've made over the past years.
Oh, okay. Thank you for sharing this. Okay. How does the myoact system perform in terms of accuracy for detecting muscle activities compared to other devices?
So the accuracy is actually the same like the other devices because we are using the hardware of the other devices. So it's so easy to say.
Yes.
For example, all the filters that are integrated, they are in the sensors.
Okay.
And we are not a hardware company, so we are producing the software behind. And that's the reason why, because it's really important that all the technical devices are on a really high level. And we say like, hey Mike, there are really good companies in the world producing good EMG hardware. So we take their hardware and we produce a better software. Because the problem was all the good hardware companies, they were not that good in producing a software for the practical approach. But we know what is needed in the practice. So we focus on the software and just use the hardware of the others. So therefore the accuracy is the same.
It's the same. Okay, good answer. Okay, what key features or metrics in the myoact app should users focus on?
Yeah, we actually have 3 points of interest. As soon as you have done a mapping, there are 3 things you get presented. The first is the hypertension, the potential hypertension in the rest position. So we have a test battery, a mapping procedure. So every muscle has its specific test battery. And one test in every muscle is the standing position. And we don't want to have in any of the muscles, instead of 2, a tension higher than 15 microvolts. All right?
Okay.
So if someone, as you have seen today, if someone is higher in this case, then it's presented red. And then you can try to fix it. Sometimes by activating somewhere else a muscle, and then you can decrease the activity. The other one is the so-called balance score. So we focus, for example, on left to right of the individual, or vastus medialis versus vastus lateralis, or the biceps femoris versus the semi group. So, and there you have all the different testings, and each testing has its own balance score. And then you have all together, you have a calculated average of those balance score. That's the overall balance score. And we say like every balance score over 80% is quite good. 80% means like more than 80% balance means less than 20% of imbalance. All right, we just turn it around because we focus on the positive and not on the negative. All right, yeah, that's a big issue. So because like it should motivate you to improve your potentially bad or weak spots in your body, and so it should motivate you and not depress you by focusing on how imbalanced you are. And everyone is kind of imbalanced based on his daily routines. And what we observed is that if you are balanced over 80%, it's totally fine. If you're balanced between 60 and 80%, it sounds like, 60% balance means 40% imbalance. So one muscle is doing 40% less than the other side. In our case, it's still like a yellow zone. It's nothing where you have to stop immediately and raise the red flag. It's just like, okay, I need to gain more information and then try to intervene. And everything below that, that is really the red issue where we must say like, okay, In this case, someone is not even possible to address a muscle, for example, site-specific. And this is something we observe might create problems in the future.
Okay.
Right.
I see. How should the order of sensor placement be determined for effective measurement?
The
order of sensor placement. So for example, if I want to the pull-up, right?
Yeah.
Like let's say I feel like I cannot do that many pull-ups. Then how do I know which muscle to map first?
Got it. So we have a recommendation now based for specific sports, specific injury regions. But if you want to have like the basic idea behind is to be good in EMG, you have to also be good in understanding movements. So always be clear if you want to get a better understanding about the movement. You should know which muscle is a main character in the specific movement. Alright? And if we, for example, focus on pull-ups, so then the scapular setting is a really important one. A lot of people, this is actually a good study, a research, which was shown with the latissimus pull down. I don't know the machine where you have the
lat pull down.
Lat pull down. And they observed, they put sensors on the biceps and the lat. And for especially for the male athletes, they use more biceps than lat. Because they are so like,
it's more connected.
So connected to the biceps but not to the lat. So you have the lat pull down exercise machine, which is specifically made for the latissimus, but the majority of the men
still use biceps.
do it as biceps training. So you need to be sure, okay, this machine should address, in this case it's the name of the machine, this machine should address at first the lat. So I understand, I put the sensor on the lat, and then I put the sensor on the potential like compensating muscle. And then you can see, okay, I want to have at least the same activity like in the biceps or like in the timing. Because there are muscles, we say they are the stabilizers and others are the movers. And the stabilizers has always be first active before the movers. So if you want to have, let's say your pull down, we have the lower trapezius, which is a stabilizer for the scapula, and the biceps is a mover. So if we put one sensor on the lower trap and one on the biceps, and I tell you let's do so, I want to see first the lower trap and then the biceps. In many cases that's not the case. And if I say please start first with scapular pull-ups, so you keep your arms straight and you focus only on activating the lower trap. Is it possible? A lot of people can't do that, and they maybe co-contract with the upper trap.
So would you? So would you recommend to follow the level 1, level 2, level 3 categories in the app? So we map the level 1 muscles first for the exercise that is involved, and then go down to level 2 and then level 3. And once all 3 is done, then you do maybe one sensor on level 1, the other sensor on level 2.
Yeah, we definitely recommend to start with level 1 because these are the stabilizers. And then you can decide like want to go on level 2 or level 3. Depends on, because let's focus for example on running sports. We have mainly 4 muscle regions which are really important for us. This is the gluteus medius, the hamstrings, the vastus medialis lateralis, and the peroneus longus. And it depends on, like, The majority is not that bad in activating like the vastus, the quadriceps and the hamstrings. The most of the people have an issue by controlling the gluteus medius and the peroneus, so the foot pronation.
Yeah.
And we observe that if you have an issue in your pelvic and in your foot, then often the knee is the point where the symptoms occur.
Oh.
And again, we talked about this today, it's not always the region which is less active, which is producing symptoms, but the region which has to compensate that. And the knee is really, really often like a region which is overused by a underuse or let's say poor activity of the foot and the hip. So my recommendation, start definitely always in this case with the gluteus medius, then take a look on the foot, and then maybe go on the quadriceps. But this is actually sometimes you will experience over the time and then make your own picture. But the stabilizer always first.
Always first. Okay, thank you. Can EMG data be utilized for injury prevention in sports, and does it have diagnostic value?
Well, the researches in that topic are ongoing. We say yes, it's a part of it, all right? So injuries, to create the injury is always multifunctional. You can have the best activity in the world, you can have the best strength in the world. If you have a poor sleep over time, a bad regeneration, and your nervous system is not able to compensate it somehow, then you will come to the pitch and you will do your football, whatever, and then you can have a risk to get injured, all right? But you can have the best rest in the world, you can have the best strength in the world. If your nervous system is not able to address a strong muscle in the right situation, then also it can occur to an injury.
Okay.
So as you can see, it is standalone, not the solution behind every injury, but it's definitely a really important factor which now we don't really observe. Like it's starting, EMG is getting really more and more are using it, but you need to remember, talking about muscle imbalances, talking about hypertensions, hypotensions of muscles, we are now just by using our eyes and our fingertips. And it's like, I mean, AI is on the world right now. It can't be that we are still observing our patients such subjective and not starting to objectivize this issue. And in the future, we are really sure by collecting more and more data correlated with injuries, more and more studies will coming up. AI will definitely do its job in this case, and I bet that we will figure out patterns that can tell you if you don't fix it, you have a higher risk of an injury. I'm pretty sure, because this is what we are already observing.
I see. How do we control or standardize subject movements during testing? For example, ensuring proper arm raising technique without shoulder shrugging.
Yeah, so therefore we have this mapping with each testing has a specific video which is shown, and you have to copy that movement. But what we are not doing in the first row is correcting the patient. If the patient or the athlete is doing a wrong raising of the arm by, for example, shrugging, then it's a false pattern, but it is his pattern. And when I test, I want to see.
His original pattern, so you know what caused the problem.
That's it. Because as soon as I correct him in the testing, I create a false test, because it's not his pattern, right? That would be the same when I say like, okay, I want to check your blood based on vitamin D, but take vitamin D supplements before, because I want to be sure that everything is okay.
Yeah.
Alright? That doesn't make any sense. I want to check what is his specific pattern right now, and therefore I just let him go. And even if I tell him, hey, raise your arms, and he's doing the weirdest thing ever. It's his way of raising arm, and this is what I want to measure, and then show him why is it not correct, and then to fix it.
Okay, good answer. Next one, which metrics in the data reports are commonly used to identify muscle imbalance?
Well, it's the balance score, basically, that's the main thing. Well, we also have the MVAs, the so-called maximum voluntary activation. It's a bit correlating to the MVC, you know, from normalization. So we don't use, in this case, a resistance you are not able to overcome. We use the body as in the end of range of a ankle or a joint. So for example, when I want to do an MVA for the biceps, it's like going on the point where you can't go further and then activate it as high as you can. Or like shrugging your shoulders as high as you can. Put them down as high as you can. So we use the individual body limits to create this MVA. And the higher this activation is, the more the athlete is communicating with the muscle in the daily routine. And so when someone is coming to me and he's telling me that he is doing 5 times a week football playing, I want to see a high activity of the gluteus medius. Because I know the gluteus medius is a really important muscle integrated in this running procedures. And then I can do the mapping, and then I can really clearly say I want to have more than, let's say, 250 micromoles. Always knowing that the fat, the subcutaneous fat, is an issue. If you have too much fat, then you can't say that, alright? Then it's always less. But the normal people, like roundabout, you can go in this direction, alright? So we have a big range from 100, or let's say lower than 50 microvolts up to the highest what we have measured was like in the gluteus medius 1800. So in this range we definitely see over like 50,000 measurements. Like low performer are somewhere between, starting really bad, from 30 up to let's say 150. The mid performers are somewhere between 150 and 250, 300, and the high performers are from 250 upwards. So that's an observation like we are definitely doing, and the most important is that you always have to do the same testings. It has to be reproducible, so it can be comparable. And out of this data, you can read out the balance score, left, right, whatever, upper, lower trap, and that gives you the best idea about muscle imbalances or not.
What does it imply if an individual displays strong muscle strength but weak EMG signals?
To be honest, never have seen it. I definitely have never seen a strong person having a low activity. It's saying like define low, alright? In our myoact approach, the low activity is something below 150 microfolds. I would say here, live on camera, that is definitely impossible. Impossible to have a strong person, to give him a task, maximum voluntary activation, and it's a low activity. No chance. You only get a low activity of a strong person when you give him a task which is not when it's in his case, not
Was it light for him?
light, yes.
Okay.
Let's make it like this. If you have a really strong person, and I ask him to lift this glass, then he definitely can lift it with low activity. Okay, that's economic. If you have a really weak person, and I ask him to lift this glass, then he potentially creates a higher activity than the strong person in this specific task. So therefore, this movement patterns also in our app are not saying good, middle or bad. Therefore the color is white.
Okay.
But if you ask the strong person, let's go on the biceps, to do all he can,
it will definitely be high.
Never seen that and we're talking about like sometimes like less strength people, but still strong. They can have a higher activity based on, for example, we see that like the climbers, they sometimes have higher activities in their biceps comparing to a weightlifter. But then we are talking about more than thousands. We're definitely over 1,000 microvolts in both cases. And I say it's not possible to be strong and have a maximum voluntary activation lower than 150. Because this is a low activity. In our case. Not possible? Otherwise there's so much fat. I don't know. Okay, but then
it's a measurement thing.
Yeah. But not possible. Never seen this in 15 years, over 25,000 measurements I personally have done. Never seen this. Always in context, okay? So a strong person, maximum voluntary activation is normally always over, let's say 500, and a really weak person in the specific muscle can create in general less than 150.
And earlier you mentioned about a climber that has more activation than a bodybuilder. And the typical image for bodybuilder is very big, but a typical image of a climber is small. So does the activation compensate for the size, for the strength, or?
No, I don't. I don't. Let's put the size by side, because in this case, always remember what creates the size of the muscle. What we measure is the electricity in between every fiber, and then you have the summation, and you have this first podcast, our webinar. I guess it's also explained. So you have a summation of all the motor units, and a muscle which is bigger, you also have more fat and more water in the muscle. So the electrical signal is reduced to the factor that there are also non-active.
More resistance, for the electric.
For the electric, and therefore it can be like reduced. All right. So the size is not telling you anything about the capacity of the EMG. And why do we see that, for example, a climber or even a tennis player having more activities in the biceps than a weightlifter? Because the number of amount of communicating with the muscle of a climber and a tennis player is normally higher than from a weightlifter. The weightlifter is using less repetitions, but with a higher resistance to create hypertrophy and maximum force, strength, right? And this is necessary. But the tennis player and the climber, they not really always use 100% or 80% of the maximum strength, but they use it really often.
So the repetition is actually the key for training the nerves and increase the activation. That's why 1,000 reps.
That's the reason why, if you want to change a technique, let's say, I don't know, you play golf. Well, like golf is really hard. Let's say much easier way, like you train like the
Javelin.
Yeah, the javelin. All right. You said told me you starting right now.
Yeah.
All right. Let's pretend you taught yourself and you taught yourself the wrong technique. All right. And the technique is it's scored. It's like stored in your brain. Like there's a saved. And now you go to a trainer, and the trainer is telling you, "Oh my God, you're doing the false technique. We have to retrain you. We have to reprogram your technique." So he starts to cut the technique, the movement a little bit up, and then he's showing you the new technique. And then he will tell you, you have to do this at least. There's something like the science telling something about 1,000 to 10,000 times. It takes so long to override the old technique pattern, so you don't have to think about it anymore. All right, and that's the same in the non-voluntary activation pattern. Sometimes we create a technique based on a history of injuries or whatever, and our body is always using this one. Oh, we're doing pull-ups, yeah, more biceps. Now if someone is coming, no, you need to take more the latissimus in the lower trap. And then you have to first start by really controlling voluntarily, and then do it 1,000 times voluntarily to integrate it non-voluntarily in your movement. So it's the number which is counting when you talk about nerve manipulation or like neuromuscular manipulation, and not like in creating strength or hypertrophy.
Not the resistance.
Yeah, there the resistance is more important, and actually less repeatings, but high resistance.
Okay, I see. Thank you very much for the answer, and I think we're about out of time for this time. I know we still have some more questions left, but I think we can save that for the next episode.
Yeah, thank you very much. I'm really looking forward to it.
Yeah, thank you so much.